be asked to be part of this group and work with this group. I'm a newbie to the area. I've been in Cincinnati for the past 35 almost years, and things are a little different down there, but they're not any better. In the area of maternal child health, we have a huge, and the report from the health department on maternal child health needs assessment was fabulous. It would be nice if we could take each aspect of that and make it happen. Unfortunately, you can only, as my mom used to say, lead a horse to water, you can't make him drink. So maternal child health affects pregnancy, childbirth, and child health. There are many, many components of that. Certainly all of the social determinants of need impact maternal child health, how women who become pregnant, preventing pregnancy if that's their desire, having an appropriately timed pregnancy, having a healthy pregnancy that includes easy access to prenatal care, prenatal vitamins, the important things of smoking cessation, illness prevention, intimate partner violence goes up in pregnancy. So if we can impact all of those, we can really make some good strides in promoting maternal child health. In Portage County, the rate of preterm births, which is a significant determinant of long-term child health, is 11.84%, less than 37 weeks. Very preterm, which is less than 32 weeks, is 1.8. That number, especially that 11.84 with the less than 37, the goal with all of the obstetric and gynecologic community is to make 40 weeks of gestation the goal. And everything we can do to eliminate early elective deliveries, because although we like to think we can time pregnancies appropriately, sometimes we miss. So we need to really work at convincing women that they want to go the full 40. They want to wait until labor starts. They don't want to induce labor or schedule a C-section because it's convenient and I can arrange for my family to be here. So we need to really look at minimizing risk of preterm birth. A lot of that is illness prevention. We know that women who have infections tend to deliver early, so if we can identify infections and treat them very easily, we can minimize the risk of preterm births. Maternal smoking, 22% of mothers in Portage County smoke during pregnancy. That to me is appalling because it contributes directly to preterm births and it contributes directly to long-term childhood problems. Babies born to women who smoke, because they usually don't stop smoking when the baby gets there, are at significantly higher risk for asthma and upper respiratory infections and problems. So it has a lifelong impact when the mom smokes. So we can really decrease that smoking in pregnancy and for the long term. Both of these areas of need were identified from birth certificate data, and the county's performance is worse than corresponding national targets. And we need to really work on that and get those back where they need to be.
Thank you for
That's the problem. Okay. I broke it. I'm so good at that. Okay.
at your service.
The next area of health need is chronic diseases. Chronic diseases are those diseases that you get them, and as my old boss used to say, you die with them, not from them. Or you die from them, you die with them, not from them. They can be lead to shorter life expectancy, things like stroke and heart disease. A lot of people in this county and a lot of people in the country are living with heart disease, high blood pressure, 166 deaths per 100,000 people in the county from heart disease, 34.8 from stroke, and that's worse than corresponding national targets. A lot of it is those social determinants of health. Again, the behaviors surrounding health can help to really bring those numbers down to where they need to be to keep the people of Portage County healthier. Prevention of diabetes and blood pressure are also needs supported by the partnership. Those two contribute. Diabetes, blood pressure, heart disease, it's sort of the magic triad that contributes significantly to mortality and morbidity. And the next area is oral health. Oral health significantly affects adult and child health. The problems with oral decay and oral infections. Interestingly, as a women's health nurse practitioner, the correlation between gum disease and preterm birth shocked me. I did not realize that there was a direct correlation, but there is. So we don't realize always the impact that oral health has on overall health. And it's a need in the county. Within Portage County, 17.2% of adults have 6 or more teeth removed due to tooth decay, gum disease, or infection. And 22.7% of third grade students have untreated dental decay. So we need to work on making those numbers better. And I will turn it over to Ryan. And maybe this will work for you. I don't know. Maybe it will get it forever.
Yeah, it doesn't seem to be working. I don't think it's good. I'll just say yes. Good evening, everyone. I'm Brian Duchamp, President and CEO of the United Way here in Portage County. Before I begin, I have to thank Dr. Hornby, the folks at Kent State University, the health departments, and really everyone who participated in this process. Their leadership and organization was critical in making this happen, so I thank you all for that work. I'm going to talk a little bit today about access to care. When we talk about access to care, what we're referring to is the availability, affordability, accessibility, and the level of quality of healthcare systems and healthcare providers here in Portage County. Specifically, the partnership identified prenatal care, lack of health insurance, lack of dental care, and affordability of prescription medications as the central needs to access to care. Looking at the data, the partnership identified some census data showing that 13% of Portage County adults are without health insurance. We also found a staggering number of pregnant women, in particular first-time moms, mothers who are from poverty, who are not receiving that critical first trimester prenatal care. And finally, the partnership found data showing that 16% of Ohio's children are without dental insurance. So those are some of the main needs that came out of access to care. On the next slide. The next item I'll talk about is prevention and wellness. When we talk about prevention and wellness, we're really talking about the mitigation of potential health complications through the use of regular activity, exercise, proper nutrition, screening, and early diagnosis and treatment. Together, the partnership identified lack of physical activity, poor nutrition, and unhealthy body weights as 3 of the main prevention and wellness issues facing Portage County. The group found that 14% of low-income households are unable to walk to a local grocery store, and 8.6% of Portage County residents live in what is considered a designated food desert, meaning they lack access to fresh, healthy foods. Additionally, the partnership found that 24% of Portage County children and 29% of our adults reported themselves as being physically inactive. Finally, we found that 19% of children are overweight, and about 22% of adults are classified as obese, which is that next level up from being what we consider overweight. Both of these bring a greater likelihood of additional health complications. Next slide. Finally, I'll talk a little bit about cancer. We were looking at the issues of cancer in Portage County. The partnership focused on screening, early diagnosis, and treatment of cancers, specifically the prevalence of breast, lung, and colon cancers here in Portage County. The partnership found that overall Portage County has a cancer mortality rate of 161.4 deaths per 100,000 people. Breast cancer accounted for 104 deaths per 100,000. Lung cancer was 53.7 deaths per 100,000, and colon cancer rounded out at 21.1 deaths per 100,000. When looking at those mortality rates compared to the healthy people targets, Portage County has a higher mortality rate than what we see for those mentioned cancers. Now, before I turn it over to Chip to talk a little bit about some of the next steps from the health departments, I want to talk a little bit about what we're going to do at United Way with this information. What we're going to really look at using this information and the information of future meetings of these groups and these subject matter experts to really help align our funded programs and initiatives at United Way. Currently, United Way is funding about 14 health-related programs here in Portage County for a total investment of $238,000 just from Portage County, United Way of Portage County. I want to make sure we're using that money in a way that's meeting those critical needs in the most effective and efficient way possible. So we're going to make sure we're aligning our programs and our initiatives with the work that's coming out of these groups. So these programs range in services from medication assistance, access to care, addiction counseling, some prenatal supports, diet, nutrition, and mental health services, as well as services to seniors. Moving forward, United Way's Board of Trustees is going to officially adopt the findings of this partnership and future findings from this group to develop a 3-year health initiative grant that will seek to connect United Way funded programs with identified health needs, evidence-based best practices, and measurable program outcomes. Our goal is to align our limited resources with a larger community health plan. And we're doing that because we know that if United Way, along with other service providers and funders doing the same, together we can really drive large-scale sustainable changes in Portage County's health outlook. Again, I want to thank Kent State University and everyone at the health departments for their work. I'll now turn it over to Chip, and he'll talk a little bit about the health departments and their next steps.
Jeff and I have talked about it, and Jeff...
Oh, you guys are going to switch? Okay, we'll turn it to Jeff first.
He insists.
Jeff Neistat, City of Kent Health Commissioner. I'm going to talk real briefly about the next steps, at least from our standpoint at the Kent Health Department. 4 things I'm going to touch on are primary data collection, accreditation obviously, community health improvement plan, and obviously strategic planning. The community health assessment was one of the 3 prerequisites towards public health accreditation, one leg of the 3-legged stool there. And it did a wonderful job revealing obviously areas of needs where we can actually do some more research and obtain some more primary data. The assessment, I think you saw from several of the slides, some of that information on it was somewhat time sensitive. A lot of it was for Ohio, a lot of it was for Portage County. Well, that doesn't help me out here in Kent too much. But it gives me an idea of where we can dive into future assessments in obtaining some primary care data. It's also really revealed through the assessment process, at least from my eyes, that like Joel's group and Chris Dummer's group there at the FQHC, they do their own assessments. They do a lot of data collection efforts on their own. I think we need to figure out a way to start to pool some of these assessments and data sources so they can be utilized properly for really all parties in Portage County moving forward. Accreditation is the other thing. I know Chip has already the train has left the station on accreditation for Portage County. We're just getting started here in Kent. We'll align some resources to get us an accreditation coordinator position filled early this year, which will obviously work with Karen and Joel's group and everyone else in really achieving public health accreditation, because I know that's one of our big goals. Community health improvement process. This is kind of the next step. Now that we have the assessment done, what are we going to do with it? The community health improvement process is really the so what. Now that we know some areas and needs, how are we going to properly address these needs in our community? That's a big step going forward. And that's something that I think as a group we're all going to get together and really figure out what resources we have to address some of these health issues and how we can best do it in a collaborative effort. And then finally, strategic planning. I know our Board of Health here in Kent, we partook on a little bit of strategic planning journey the last couple of years, and we have a nice template going forward. But now that we actually have some assessment data, followed by a community health improvement plan, the third prerequisite for public health accreditation is a strategic plan. I was fortunate enough to get a scholarship to attend a strategic planning session from OSU School of Public Health later this month. It's a 3-day session, so I plan on bringing some of that back. Well, all of it back, working with Chip collaboratively and sharing that amongst the boards of health, as I know that's a thing that Portage County needs to do as well. So I'm going to turn it over to Chip now, but those are really just the 4 brief parts that big picture items we're going to be pursuing in 2015.
Thanks, Jeff. Welcome, everybody, and I really also want to thank all of you that are here tonight, but especially those that have participated on the committees. We keep going to the well over and over again, and we get the same dedicated people, and I can't tell you how much we appreciate it, because without you guys, we couldn't get this done, and I think Ken would have pulled their hair out even more. I want to say one thing. I agree with Kelly. Biology you can't change. I was born bald, short, and fat, and I'm going to go out bald, short. Anyway, when John came, he says, "Well, what's your next steps? What are you doing? What have you done?" And so I decided, well, let's get this done right. I walked into Karen's office and sat down and said, "Karen, I need to have something put together that says what we've done and what's the future outlook for the Portage County Health Department." She says, "Well, I've got that right here." And she had it done already. I didn't have any. But the only problem was, as soon as she gave it to me, the first thing I had to do was take it and blow it up so I could read it. I got the Reader Digest version. She gave me this number 10 font purposely, I think. So, first of all, I want to say that we're going to continue what we've always done, and that's enforce public health laws, protect the public from hazards, educate and inform our residents, and help them to access dependable, affordable health and social services. But we now have the resources to focus our efforts on our most vulnerable populations. As most of you know, up until about a year and a half ago, we were struggling just to keep our heads above water. We didn't have a whole lot of money. We got $237,000 from the community, and the rest we had to make up with fees and permits and stuff. And so we were, at one time, one of the highest counties around for our permits. We're no longer in the category. But the levy monies, and we're thankful to the citizens of Portage, townships and cities and streets where we were for helping us pass that levy. And we are now moving into areas such as minority communities, low-income communities, seniors, teens, the uninsured. Other resources are being used to develop new programs. We are starting a smoking cessation, counseling and education program, cribs for kids, safe sleep outreach, bicycle safety and helmet distribution, healthy homes, lead education, matter of balance, falls prevention for seniors, comprehensive sexuality education for adults, and opiate education initiative for Portage County. And that's since the levy. I think that's pretty good for just about a year's worth of work. We've also expanded some of our existing programs, like our literacy program, which has been a tremendous success. And for those of you who aren't aware of that, if you don't have the resources to get car seats, we know how important they are. And through the Portage Foundation, the Ravenna Elks, and is there anybody else in there missing that they've donated money for us to buy seats, and so we have seats available. Not tomorrow, but hopefully within the next 2 weeks we'll have more seats available. They go just about as fast as they come in. It's a tremendous program. We also do HIV testing and counseling. That's a program we picked up also. We had a small grant from Southern County Health Department. They decided it was more important to keep that money in Southern County, so we decided that program was important enough that we fund that, and so we're very proud of, and also the individual that does that program has been a real go-getter, and we've expanded that program tremendously, so we appreciate that also. Health education presentations across the community on topics such as communicable disease, emergency preparedness, child safety, bed bugs, and lice education, nutrition and physical activity programs. And to serve our Portage County businesses in innovative ways, we offer them now Serve Safe certification for restaurants, We have bed bug education for hotels and secondhand shops, workplace health education sessions, and helping to design workforce wellness programs for local businesses. We're already engaging Portage County residents and service providers in new ways to improve community health. New coalitions and partnerships with minority community of Portage County. And I want to expand on that a little bit. Frank Hairston came to us at one of our meetings and said, hey, I really don't think you're addressing the minority communities. We've got to do something. So we met with Frank and a couple of the minority leaders in the community. And I'm proud to say that we've formed a coalition with them, and we've got a committee together now that's going to meet on a regular basis. And I've been here 30 years, and so for the first time in 30 years, we will be at the King Kennedy Martin Luther King Day celebration, and we'll have a table there for the Portage County Health Department. So that's been great, again, through our health education division. We also have Portage County Workforce Health and Wellness Coalition. We have a Portage County Fire Chief. We have a seat on their committee now, and so we attend the fire chiefs meetings from around the county. And we are looking to establish new ways to partner with familiar agencies like Robinson. We've now partnered with them for a smoking cessation program, and we're looking to partner with Robinson in many other programs. Kent State Center for Nutrition. Right through Kent State, we've had a nutrition program for a couple of years that we work with them, and that's been an extremely successful program also. And we just met with the director of that program yesterday to look at other ways where we can expand in that area, and we're really hoping to do that. And also we've worked on a regular basis with Neomed. We are an affiliate health department with Neomed now, so we have an official basis with them. And we have more opportunities for residents to learn about public health. We're offering the Medical Reserve Corps. We've hired a part-time person to help us expand that, so we're looking to do that too. We are going to have hopefully town hall meetings to educate residents about public health. We also plan to continue Kent State's work through the Robert Woods Johnson Foundation. We'll continue to work with the Kent City Health Department to identify opportunities for shared services. Just this year, for the first time, one of our campaign promises was a mosquito program, and it really just wasn't something that we could jump into right away, so we contracted with Kent City Health Department. Jeff offered right away, and so we had a nuisance program and a baiting and trapping program for mosquitoes to identify hotspots in the area. Again, very successful, and Kent City did a fantastic job there. And internally, we will continue to work hard towards accreditation, which will ensure we are meeting the 10 essential health services. And I won't go through those, but if you're not aware of those, just go to Google and go 10 essential health services, and you will see some amazing things. We can't, I'll be honest, right now we can't meet the 10 essential health services. But in 2 years, hopefully when we apply for accreditation, we will be on the road to meeting all 10 of those. And that will take a lot of input from our community partners to do that. The CHIP will be done in 2015, followed by a new strategic plan. And Jeff and I have been meeting with some different providers to see what our best option is for the CHIP. And so we hopefully will be moving ahead with that sometime in no later than February, because we need to get that going too. You should expect to see new programs and policies that will be developed to meet those goals. And those programs are going to be measurable, evidence-based, and community-driven. That's something that we really haven't done before. We are already strengthening the health department by engaging the staff in workforce development and quality improvement projects, which will feed into an ongoing performance management system. So you can see that, first of all, we've taken the increase in our levy monies very seriously, and we've taken this Robert Wood Johnson work and the work that all of you have helped us and supported us, and we've taken it serious. We will continue to take it serious, and I think in the next couple of years, you're going to see a major change in your county health department, and I'm hoping that we will never be in the situation that we were where it took us 55 years to pass replacement levy. So that's what I have. Thank you.
Comments, questions? Make sure that we have your email address so we can get your copy of the report. I do want to point out that there's plenty of food left. We have the room until 10. You're not but, we do hope that you'll stay and socialize a little bit, enjoy some of the food and drink, and have some conversations going around today's subject and just anything else that strikes your fancy. We appreciate you being here. I'm sorry?
I have a question.
Okay.
I'm just a Portage County resident. I'm not an expert like so many of you are. And like Joel said, we have a growing epidemic in the county of opiate heroin addiction. And it's been mentioned this afternoon, but I'm not hearing that there's more money being allocated for any of the programs. What I'm really looking at is a Narcan program to help with all the overdoses.
Anybody? Joel or anybody else?
Or partnering also, possibly with a hospital for detox. Yes, Alden has some beds. I mean, these are two great needs that I've heard addressed. And also, the opiate education that was just discussed, I wondered if we could have some more information about that.
I would like to address her.
Sure.
Actually, I just wrote a grant for Narcan. Yes, I did, so I won't know if I get it until April, but I've actually met with the drug task force and Rebecca and the sheriff's department. So we are trying to work on that. And Rose, for our drug business and health department.
Yeah, Rose is our nursing director, so she's with Portage County. For those of you that have been on the committee meetings, just to answer that question too, Dennis Massetti of the Sheriff's Office is extremely interested in getting us involved. Now, at the Health Department, we've already had a session with the police officers and that with for crack and methamphetamine. And we are going to, we've already sent one of our health educators to some different meetings on the Narcan opiate situation and what we can do in our programs. Our first step is, as Rose said, is to apply for the grant. But I want you to know that it's on our radar. It's something that we know we have to address, just like Joel. He gets probably more involved in the real down-to-earth mechanics of that. But we are involved, and I think it's something that we're going to work on together. And that's an issue that's countywide. So you're going to see the Kansas City Health Department and us, and mental health, and probably the hospital. You know, we're going to get into that. But it is on the radar, I can assure you.
Other comments?
I'll jump into the mental health side. Yeah, because money's always an issue. We're into the new biennium budget planning process. Legislators are a good way to go. We have, Kathleen Clyde, we have another representative, Susan Mazzarette, John Eckles, our senator. We do have to apply some of the pressure and express the needs that we have here. The other part of the, like I said, we've been involved now, we meaning Mental Health Recovery Board, with this process, and I think I'm looking forward to some partnerships, because I think there's some opportunities maybe for additional dollars and funding, some collaborations with the health department, mental health board, and state, and I think there's some other areas that we could find some additional dollars. But yeah, unfortunately, we keep hearing things like they're going to make us cuts again coming up. They're going to take away our Medicaid expansion. So there's things where we're going to have to rally the troops here to put some pressure on our legislators, because they're the ones who are passing the laws and passing the budgets that affect us all. So, and I know you're out there cheering for us, so I'll have you rally the troops as well.
One of the most important things, I'm not aware of anyone around the state or the country has any kind of definitive resolution of the problems related to opioid addiction. They're certainly profound. They have terrible impact on the community. One thing that I'm pretty sure of, and I suspect suspect most of us would agree, is that we need to find ways to collaborate and work together on that issue as with all of the others that have been indicated. We know that the judges and the courts have expressed an interest in doing something positive to impact that issue. We know that the mental health systems and the Mental Health and Recovery Board has an interest. We know that the health departments all have an interest, and the college. The question is going to be, can we find a way to collaborate effectively to benefit the whole community? And I don't know what the answer to, I don't know how to fix that problem or even necessarily how to address it, but I'm sure that if we could work as a group and draw on the wisdom of crowds, as it were, all of us together jointly, we may be able to fashion a response that begins to address the issue here in Portage County. So, you introduced yourself as just an ordinary citizen in Portage County. Ordinary citizens in Portage County are going to have to help, have to be part of the way that we address this problem. And so we hope that you will be willing to do that. Anything else?
I just want to say something in regards to we talk about the community health improvement process, and I hope that this doesn't just sound like a bunch of bureaucracy to those of you who have not been part of the public health system, but really this was our very first step, was really trying to identify what our health needs are. And we never really did that before. We just really kind of took for granted and did what we had funding to do. And really a lot of that was based on what the law told us we had to do. So now that we have health needs identified, our next step is to try to align, as what Brian said, I think very eloquently from United Way, are we using the money we have in our healthcare system in the right way and in the right places? And how can we work together to bring all of the money that we do have in separate silos and in separate pots to fix the health problems? And we understand that this one is accelerating very quickly, and has really been something that has not always been on the public health system radar in the past. So I think that this process has brought it to the forefront of being a public health issue, and I think our community health improvement process, which again, is not really just bureaucracy, it really is trying to find where do we have the right resources to fit those needs and trying to bring all those needs together instead of us trying to all fight it separately, which is what we have tended to do in the past in Portage County. So I hope that helps to answer your question if you're not been part of close to it. Yeah.
Yes.
Rob, this is kind of a question for Mr. Neistat. For Jeff, here in the city, I've been aware of the fact that we have and along with the concern for cocaine and heroin and other drugs in town. Does our health department look into